Managing type 1 diabetes. Review of therapies and lifestyle changes for diabetes. Type 1 diabetes is an autoimmune disease that develops when the body destroys the cells in the pancreas that produce insulin. This means that people with type 1 diabetes do not make insulin. Without insulin, the body cannot regulate the amount of glucose in the blood. Like and subscribe my page. People with type 2 diabetes develop a decreased sensitivity to insulin, which means the body does not make or use as much insulin as it needs. It is the more common of the two main types. This article reviews therapies and lifestyle changes that can help reduce the effects of diabetes on a person's health. Is diabetes curable? While diabetes is incurable, a person can stay in remission for a long time. No cure for diabetes currently exists, but the disease can go into remission. When diabetes goes into remission, it means that the body does not show any signs of diabetes, although the disease is technically still present. Doctors have not come to a final consensus on what exactly constitutes remission, but they all include A1C levels below 6% as a significant factor. A1C levels indicate a person's blood sugar levels over 3 months. According to Diabetes Care, remission can take different forms. Click on my link for more details. Partial remission, when a person has maintained a blood glucose level lower than that of a person with diabetes for at least 1 year without needing to use any diabetes medication. Complete remission, when the blood glucose level returns to normal levels completely outside of the range of diabetes or pre-diabetes and stays there for at least 1 year without any medications. Prolonged remission, when complete remission lasts for at least 5 years. Even if a person maintains normal blood sugar levels for 20 years, a doctor would still consider their diabetes to be in remission rather than cured. Achieving diabetes remission can be as simple as making changes to an exercise routine or diet. Managing type 1 diabetes. Type 1 diabetes is an autoimmune disease that often develops during childhood. It occurs when the body mistakenly attacks the beta cells of the pancreas, removing their ability to produce the insulin that the body needs to use blood sugars correctly. Receiving a diagnosis of type 1 diabetes can be daunting, yet many people manage the condition well, keeping symptoms and severe complications at bay. Insulin treatments. Insulin injections are the most common treatment for type 1 diabetes. People can self-administer these injections at home. There are a range of insulin injections available. They vary according to how quickly the insulin works and how long its effects last in the body. Insulin's aim is to mimic how the body produces insulin throughout the day in relation to energy intake. Insulin treatments work at different speeds. The chart below highlights the types, how quickly they work, and how long they last. The information comes from the DailyMed database. Insulin type, speed of action, duration. Rapid-acting injections 5 to 15 minutes 3 to 5 hours. Short-acting injections 30 to 60 minutes 6 to 8 hours. Long-acting injections 60 to 120 minutes 14 to 24 hours. The site for each injection is essential, as different locations on the body absorb insulin at different speeds. Injections into the abdomen, for example, deliver insulin quickly. Insulin that reaches the bloodstream via the lower back and buttocks takes longer to get there. A 2018 clinical trial on humans found that an existing blood pressure drug called verapamil may be helpful for people with diabetes. In the study, people with recent onset type 1 diabetes received doses of verapamil. The trial showed that their fasting glucose levels ended up being lower than those who did not take the drug. For people with type 1 diabetes, this drug seems to improve insulin production in the pancreas, reducing the need for regular insulin injections. However, the FDA have not yet approved verapamil as a treatment for diabetes, even though it has shown a lot of promise. Implantable devices. Scientists have long been researching the use of implantable devices for managing type 1 diabetes without the need for regular injections. This 2016 animal study discusses an implantable device that could protect beta cells in the pancreas. Researchers found that the device protected a mouse's pancreatic beta cells from immune attack for up to 6 months. In 2018, the FDA approved the first ever implantable continuous glucose monitoring system that linked to an app. Managing type 2 diabetes. A healthful, well-planned diet can help a person manage diabetes. Currently, it is easier for a person to reverse type 2 diabetes than type 1. This is because type 2 diabetes is not an autoimmune disease and a range of outside forces and lifestyle habits can make it worse. While this means type 2 diabetes is much more widespread than type 1 diabetes, it also means that a person with type 2 diabetes can make relatively simple lifestyle and dietary adjustments to bring their blood sugar levels back into the normal range. Dietary intake and obesity both play a critical role in the development of type 2 diabetes. As such, people can reverse the symptoms of type 2 diabetes by adhering to specific lifestyle changes that include improving their diet and exercise regimen. Medications. While lifestyle adjustments can help reduce the impact of type 2 diabetes, most people with the condition will need to take medications to lower blood glucose and boost the body's production of and sensitivity to insulin. For more details, click on my link. People with type 2 diabetes do not often need to take additional insulin. As insulin sensitivity, as opposed to insulin production, is the main issue for people with type 2, medication focuses on reducing blood sugar and improving absorption. A 2016 study found that certain interventions can help put type 2 diabetes into remission, including personalized exercise routines, strict diets, glucose-controlling drugs. 4 months after the intervention, 40% of the subjects were able to stop taking their medications and remained in partial or complete remission. Managing gestational diabetes. Gestational diabetes is a type that develops during pregnancy and resolves after the birth of the child. Many diabetes medications adversely interact with a developing fetus, so speak to a doctor about pregnancy-safe alternatives for reducing blood sugar and boosting insulin. People with gestational diabetes must control sugar intake and engage in regular, light exercise. However, if this does not have the desired effect, the doctor may prescribe insulin to control blood sugar levels. Very few high-quality studies confirm which non-insulin medications are safe for women and babies. The American Diabetes Association (ADA) advise against using them during pregnancy, although some doctors do prescribe them. 2 main lifestyle changes can help manage type 2 diabetes: exercise and diet. Exercise and weight loss. An active lifestyle can reduce the risk of type 2 diabetes. A healthful diet and regular exercise are the first steps to managing type 2 diabetes. Weight loss is the cornerstone of treatment for people with this condition. A study from 2010 has shown that increased physical activity and modest weight loss can reduce the risk for type 2 diabetes by up to 58%. The article in Diabetes Care stated that people with type 2 diabetes should partake in 150 minutes a week of aerobic activities, including swimming, brisk walking, bicycle riding. Breaking physical activity into 5 30-minute sessions throughout the week can help a person manage this amount of exercise. This may be enough to help the body manage diabetes symptoms. Diet tips. Diet tips for controlling type 2 diabetes: limit carbohydrates. Replacing carbohydrates with high-protein and high-fiber foods will help regulate blood sugar. Eat less sugar. Sugar replacements, such as stevia, may help some people manage diabetes symptoms. Fiber-rich food. Fiber can help slow down the digestion of carbohydrates and sugars. Foods to include in the diet: vegetables, fruits, whole grains, proteins, low-fat dairy products. A varied diet ensures the body receives all the nutrients it needs. People should also eat fewer calories and try to eat similar amounts of carbohydrates at each meal. Foods high in polyunsaturated fats, such as fish, nuts, and vegetable oils, are also highly beneficial for keeping down blood sugar levels. A heart-healthy diet, such as the DASH diet, can be a highly effective way to structure an eating plan to reduce the risk or effects of diabetes. Surgery. If dietary changes and exercise are not possible or successful, a person can achieve weight loss through bariatric surgery. However, this is the last-line treatment for people with morbid obesity for whom no other treatment options have been successful. This type of surgery involves reducing the size of the stomach, which helps people feel full after eating. Some types of surgery also change a person's anatomy and may alter hormones that contribute to weight gain. Gastric band surgery and gastric bypass surgery are 2 typical examples of this medical intervention. Both operations present risks, so doctors do not usually consider them as the first option. Insurance policies also rarely cover bariatric surgery. Outlook. No full cure is available for diabetes, but some promising treatment methods are under development. Working directly with a capable doctor may help people find treatment options that could put diabetes into remission. Types 1 and 2 diabetes are lifelong conditions, but the right treatment measures can help a person with either type live an active and healthy